right, this is just a brief slideshow about sensory and perceptual development. I've been working on this for a bit and I'm struggling a little with the program here to move from slide to slide, so hopefully this will move a little more smoothly as we go through. So sensation and perception are terms you probably have heard before. Sensation is how we physically or biologically experience the world. And perception is how our minds then interpret that sensation. So in an example of, say, hearing, there would be sound waves that come into our ear, hit our eardrum, causing vibrations. Those vibrations then are transferred into neural impulses that go to our brain. That's the sensation part of that. The perception part is then when our brain interprets that and says that is whatever it is we're hearing, whether it's a person's voice or the sound of a bell ringing or whatever that might be. So that begs the question, how do we study this in infants? Because we obviously can't ask them what they are experiencing. So instead, different alternative methods had to be developed. So this is called a looking chamber. It was developed by Robert Fons, and it was meant to measure how long infants looked at certain images. Studying whether infants can distinguish one stimulus from another by measuring the length of time they attend to different stimuli or look at different stimuli is called the visual preference method. Another research method is called habituation and dishabituation. In this case, an infant will be looking at a certain stimulus, and eventually, you think of it as they get bored with that stimulus, and so they don't respond to it like they did before. And then when a new stimulus is presented, then they become interested again. So habituation is the name given to the decreased responsiveness, and the dishabituation is the recovery of a response. So if a baby is looking at a picture of a human face and then eventually grow bored with that and stop paying attention to it, and then that picture is replaced with the picture of a dog, for example, then they may then become interested in it again. So what type of response do they measure in that? Usually it is like a sucking behavior. So a sucking behavior might stop when something new is shown. Heart and respiration rates might change, so those might be measured. And then just like the previous visual preference method, it might be the length of time that an infant looks at a particular object. Another method is eye tracking, which is pretty much what it sounds like. They have a device that measures eye movement in babies. So when we get into specifically the senses and we look at vision for our first example, we know that vision of newborns is about 2,600 on the Snellen eye exam. And what that means is an object 20 feet away is only as clear to a newborn's eyes as it would be if it were viewed from a distance of 600 feet by an adult with normal vision. So by 6 months, that vision gets much better. And you can see an example of this in the next picture. So the first picture being what a baby would see as a newborn and the last one as they develop their eyesight, which would be 2020. So what do babies like to look at? Actually, they like to look at faces more than anything else. They find those more fascinating. Very kind of an interesting side note, they like to look at attractive faces more than they like to look at unattractive ones. In those studies, I'm not sure who determines who's attractive and who's not, but that was what a study found. As far as color goes, infants can discriminate among some colors, even by 4 weeks of age. There have been some studies on whether they can recognize objects that are occluded. Occlusion is when something is behind something else, so you only see part of it. So if you think about like a car and it's parked by a tree, and so you don't see part of that car because of the tree, would a baby be able to perceive what that is? So in the first 2 months, no, they can't. They can only see what's visible, whereas after that, they might be able to perceive it as being more than that. Depth perception is also an area that was investigated in infants, whether they have depth perception or not. I don't believe it's been studied at super early ages, but once they are at an age where they are able to crawl, so 6 to 12 months of age, they did this study where a baby was put on a ledge and then a piece of glass was placed over a drop-off. And then the baby was encouraged to go to their mother. The babies were able to kind of stay on that ledge and didn't want to go over the glass, even though it was perfectly safe. Even though their mother was encouraging them to, they could tell that there was a difference in depth, and they did not want to move across that, which indicates that they can perceive depth. So how about the other senses? Hearing is one that we believe can be perceived in the last 2 months of pregnancy. They believe that babies can actually hear their mother's voice. This is why a lot of times you see parents reading to the baby or talking to the baby while they're in the uterus. A few days after birth, newborns will turn toward the sound of a caregiver's voice or someone that they are familiar with. And then a lot of changes start to take place, and they are able to hear differences in loudness, in pitch, and also in localization, which is where the sound is coming from, in front of them, behind them, and so on. When it comes to touch, there are obviously proof that babies respond to touch. They actually are better nurtured if there is skin-to-skin contact. If you give babies massages, a lot of times that improves health as well. An interesting thing is that for a long time, people didn't believe that newborns could experience pain. And they found this a lot of times circumcisions would take place and they wouldn't give any anesthetic for that because they didn't believe that babies could perceive pain. Now they know that that's not true. And so when circumcisions are performed on baby boys, anesthetic is provided. Smell. Babies can differentiate between smells. Through the expressions on their face, they can show the difference between the sense of vanilla and strawberry, that's something that they like, or something, a bad smell like rotten eggs or fish, they show that they don't like. They can also tell the difference between the smells of their mothers. They did a study with breast milk, and babies were able to identify mother's breast milk smell. Taste, babies are also sensitive to taste. There's an early experiment from 1940 where babies, the amniotic fluid in the last few days of a near-term fetus, the amniotic fluid was given saccharin. They added saccharin, and the baby actually increased their swallowing reflex while in utero. Now we know that saccharin causes cancer in rats, so I'm guessing that probably will not be a study that's replicated. All of these sensations are things that are considered intermodal, these perceptions. So we have what's called intermodal perception, which means that our brain is not perceiving these sensations individually. We don't go, okay, I'm processing this sound, and then I'm going to process this vision or what I'm seeing, and then I'm going to process a smell. And they all come together, and they're all done at the same time so that we can create a whole picture of what we're perceiving.